Meanwhile, as the National Health Insurance Authority hints of its decision to consider adding dialysis treatment to the NHIA's country representative of the World Health Organization, Dr. Francis Chisaka Kasolo, says the expansion of the National Health Insurance Scheme to encompass the treatment of renal diseases is key to averting these deaths. His plea follows a public outcry triggered by a significant rise in the cost of dialysis treatment at the renal unit of the Kolebu Teaching Hospital. Dr. Kasolo stressed the urgent need for increased investment in the health insurance scheme to provide the much-needed financial relief to impoverished individuals who struggle to afford essential treatment for renal diseases.
As WHO, we work with the government, and we're working, for example, with also the National Health Insurance Scheme to ensure that sufficient revenues are collected to mitigate what we call out-of-pocket expenditure. And for us, as long as we have a strong health insurance system which collects revenue, and that revenue is channeled into mitigating the cost of care, we see no reason why we should really be having increasing out-of-pocket allowance, because the health insurance should cushion the poor, and that's why the health insurance, for instance, is there. So our message is that we need to support the National Health Insurance, ensure a lot of people are enrolled on the National Health Insurance, and also that money that is raised through the health insurance levies is channeled back in mitigating the high cost of healthcare. And if that works, we will not have what would call an increased out-of-pocket allowance or payment from the citizenry. I think it's difficult to say, because cost of healthcare across the world has generally been moving up for all sorts of reasons. So we need to see and discuss with the colleagues who are in the, for example, Kolebu, to understand the reason for the increase. But like I mentioned, if our health insurance is strong, it can mitigate the cost of even renal care if the renal care is one of the on the benefit package of the health insurance. So it is for us to really support the health insurance and to ensure that services such as renal services are included in the benefit package of the health insurance to mitigate the out-of-pocket expenditures that we are beginning to see increase. And if that works, then we will have solved part of the problem of increasing out-of-pocket expenditure that we see with the dialysis costs.